I think we all have these sort of areas that every time we look in the mirror we always focus on, and for me mine's always been my forehead and my frown lines. I sort of think sometimes I look very tired. I just kind of really wanted to sort of freshen it up. I think prevention is probably better than cure as well, so sort of do something now before it got too bad.
Botox is a naturally occurring protein molecule that simply affects muscles where it's injected and causes a relaxation, albeit temporary, of those muscles. It's used in cosmetic medicine to soften muscles that are having an excess effect that may be causing lines and wrinkles, especially on the forehead area of the face.
I probably have it twice a year. When I first started, I probably had it 3 times a year, but it definitely, I think it's probably the more you have it, the longer the effects last for.
Well, really nice to see you again, Lucy, and you're here again to have a little bit more treatment with me. I think it's been 6 months or so, hasn't it, since we did the Botox? So
yeah.
Let's see how much you can frown now. So if you look, yeah, that frown is really back, isn't it? Yeah. So obviously we'll sort the Botox. So you frown again for me, Lucy. I'm just going to mark Lucy out with, this is the glabella complex, which creates the frown lines. Often people have these barcode lines or the number 11 lines here through excessive movement of the skin, and over time the skin breaks down and creates the lines. And I think that was originally why you first started coming to me, Lucy, wasn't it?
Yeah, definitely.
Because you started to see those lines developing, and the Botox, by weakening and softening the muscles, will allow the muscles to relax and allow the skin to recover and the lines to disappear.
I trust Ian now. I think sort of having Botox is one of those things, you hear so many horror stories. And yeah, I think once you find somebody that you trust, you know, he's always been so welcoming, and his colleagues, every time I've been to the clinic, yeah, it's just so relaxing that I wouldn't go anywhere else now.
Botox is one of the safest drugs that we know if used appropriately. Certainly when we inject, there may be some very transient little bumps, almost like mosquito bites in the area where the Botox is injected, but in my experience they usually settle within 20 or 30 minutes and are not apparent when people leave the clinic.
I mean, previously to having the Botox, I'd probably spent hundreds on creams that don't work. You know, there's so many creams on the market that have all these promises but actually deliver nothing. I think it's worth every penny. Definitely.
Your forehead's looking good as well. She's had, if you lift your lines, you can see the frontalis muscle lifting here to counteract the depressor muscles of the frown muscles. And this is often a battleground for a lot of people, and they'll end up with these horizontal lines across the forehead due to this overactivity of the frontalis muscle. So we can lift again, we can pop a little bit of small dosages of Botox in to the forehead just to soften the forehead lines without removing the ability for her to lift her brow. And I think that's really important because, as we've discussed before, keeping it natural, keeping it a soft look, not a completely frozen look is often what most my patients want. The sort of philosophy, less is more. So I'm using a brand of Botox or botulinum toxin called Azalure, which is a toxin produced by Galderma, one of the largest companies in the world. I use that because I can be assured of the quality of the product that I'm using. When I'm injecting Botox, we used very tiny little needles, so there's minimal discomfort from the injection. Did you feel much of that, Lucy?
Yeah, no.
Hardly anything. So as you can see, after there's very little to see. The skin itself, there might be a very slight swelling, which is transient and usually only lasts half an hour at the most, really. So most patients can return immediately to normal activities. So that's Lucy's Botox treatment done. And as you can see, there's transient little bit of redness, but easily covered by a little bit of mineral makeup when she leaves the clinic. But That should give a nice result there. Many patients are concerned that if they embark and start a course of treatment having Botox, what will happen if they, for some reason, are unable to continue having their treatments. If one was to stop having Botox, the muscle activity would gradually come back in time, and over a number of months and years one may start to see the lines and wrinkles in that area that we've been treating gradually coming back, but it will be never worse than before they had any treatment.
For the here and now, I love having it done. It really boosts my confidence, and as long as it makes me feel good, I'll probably continue doing it.